Our presentation is on qualitative critique, activities and adaptation in late life depression, a qualitative study. A qualitative study conducted by the Department of Occupational Therapy, School of Health and Rehabilitation Sciences at the University of Pittsburgh, Pennsylvania, aimed to understand the activity choices of older adults experiencing depression by utilizing a phenomenological research design. 29 participants were recruited via their primary care provider for having participated in a randomized controlled trial that investigated the combined effect of an antidepressant and a medication used for the treatment of dementia. This was to evaluate cognitive and functional performance. 2 of the participants declined to participate in the qualitative study, but the remaining 27 participants met the study's criteria and written informed consent was obtained. Among the inclusion criteria, participants were required to be 65 years or older, have a diagnosis of non-psychotic, non-bipolar, major depression as recorded in a structural clinical interview for the DSM-4, have a rating of 15 on the 17-item Hamilton Depression Rating Scale, speak English, exhibit a willingness to discontinue psychotropic medications other than the study's required medications, and acknowledge the presence of a principal investigator to corroborate information with. Regarding the exclusion criteria, participants were exempt from the study if they had diagnoses of dementia based on the criteria from the Diagnostic and Statistical Manual of Mental Disorders, bipolar disorder, schizophrenia, or other psychotic disorders, and if they had a history of alcohol or drug abuse within the 12 months prior to the study. Because contemporary research indicates that individuals with depression are less verbal and may lack insight compared to individuals without depression, researchers interviewed participants 3 to 7 months after the depression has stabilized. The principal investigator telephoned participants for semi-structured interviews, which lasted approximately 2 hours long and stimulated conversation by utilizing the activity card sort or the ACS. This measures engagement in activities in 4 domains, including instrumental activities of daily living, low-demand leisure, high-demand leisure, and social activity. The open-ended nature of the questions and individualized probing for further discussion facilitated rich and detailed narratives from the participants. There are a multitude of themes present within the study explaining why participants continued certain activities while depressed and why other activities stopped. Researchers concluded that older adults with depression maintained many of their instrumental activities of daily living, while some actively adapted activities so that they continue them, and others intentionally stopped activities to direct limited energy to their highest priority activities. There were 6 themes that emerged for activities that continued during depression, and then 4 themes that emerged for the activities that were discontinued during depression. Evaluating the methodology of the study, taking a look at the methodology itself, a strength found was that an initial pilot study of 4 participants was conducted prior to the study for researchers to hone their skills in interviewing and data analysis. Moving to the sampling, one of the strengths was that participants had been previously evaluated for depression with well-accepted measures and were already familiar with being involved in studies. However, one of the weaknesses was that although participants were described as well-characterized sample that had been previously evaluated, the sample of the study was primarily homogeneous of white women with a high educational level. The sample of the study is inadequate as it is not representative of the general population of older adults with depression. Examining the data collection, one of the strengths was that the implementation of the ACS anchored interviews and ensured consistency between the participants. However, participants were only interviewed about their depressive episode while they are in recovery, which can inhibit their narratives due to the recall bias that they may have. Additionally, participants were only interviewed over the phone for the 2-hour interview rather than in person, which impedes how the ACS is administered and also raises the question of whether participants would have grown more acclimated to the principal investigator and answered questions with more depth. Moving over to data analysis, one of the strengths was that transcripts were recorded from the semi-structured interviews, and 3 members of the research team scrutinized the principal investigator's initial list of themes that emerged from the interviews. Additional members from the research team who were also experts in late life depression, critically appraising the case examples identified with the representatives from each team. Another weakness found, however, was that within the study there was no further discussion or dissecting into the raw data obtained from the interviews. Specifically, there was no mention of the over 18 themes at the conclusion of the interviews, and they never discussed any of the emerging themes and only reflected on the 10 final themes that emerged. Additionally, transcripts were also recorded from each of the interviews but never published.
Hello everyone, so today in this slide, overview of research quality and execution, we'll be discussing about the overall critique of the research conducted by Labeled et al. In 2014. So their study aimed to explore the impact of depression on activity engagement among older adults. So they utilized semi-structured interviews and the activity card sort, just as you see right here, to gather the data from participants in recovery phase of depression. So the key findings highlighted how individuals adapted their engagement in activities to kind of accommodate depressive symptoms, and also emphasizing the potential for occupational therapy interventions to kind of focus on activity modification as a strategy for managing depression in older adults. So despite its insightful findings, the study reliance on self-reported retrospective accounts may introduce recall bias, and its demographic specificity that limits generalizability, uh, that also collects by collecting real time from a more diverse sample could enhance the robustness, also the validity and applicability of future studies. So mentioned below, there are important key points of this question for this article. So now let's delve into the clinical implications and future research directions. So on the second slide, clinical implications and future research directions, Labeled et al. 2014, provided valuable insights into how older adults engage in activities during depressive episodes and their adaptive strategies to maintain engagement. 10 key themes were identified previously, highlighting factors such as established habits, activity gratification, and the influence of family and friends. However, their study limitations such as a sample homogeneity and recall bias suggest a need for future research to kind of explore these findings across diverse populations and through varied data collection methods. Key points I would like to address from this article regarding the question are Labeled et al. Explored depression effect on activity engagement in older adults, proposing occupational therapy interventions. The study Qualitative suggested improving sample diversity in real-time data collection. Next would be insights, stress, individual adaptations, and activity engagement during depression with implications for occupational therapy. Emphasis on psychological factors and social participation aligns with occupational therapy principles, offering practical guidance. As for future research, addressing the limitations and also exploring mechanisms for anticipating activity trajectories across diverse populations. So on this next slide, in connecting findings to biopsychosocial model, the research by Label et al. 2014 reveals the nuanced ways older adults manage depression through various strategies of activity engagement. So these findings align with the biopsychosocial model, emphasizing the intricate relationship between psychological well-being, social participation, and occupational engagement. So occupational therapists can kind of leverage these insights to develop holistic interventions that address not only the physical, but also the psychological and social dimensions of depression. So thereby promoting improved quality of life among older adults. So there's important bullet points that need to be addressed, stated down below. And on the first one would be investigation into how older adults engage in activities during depressive episodes. Secondly, themes include distraction, escape, and hiding depression. Thirdly, highlights the complexity of strategies to manage depression and maintain purpose. For the methodological critique, the qualitative approach provides an in-depth exploration, but there's potential for bias. Secondly, would be suggestions for future research to enhance the validity and generalizability. And for implications for OT practice, findings align with the biopsychosocial framework, emphasizing holistic care. And lastly, insights can inform tailored interventions promoting improved quality of life. Thank you for your attention. And here are our references.